As we are approaching the end of the year, the Cancer Center leadership wants to express many thanks to many people. And you will hear a series of messages by our other leaders, our associate directors, our the clinical leaders of the different regions, expressing their gratitude and thanks to many people who did amazing efforts during the last year. So I want to start first, and I want to take the opportunity and thank the leadership of Northwestern Medicine. I want to thank Dean Harrison and also the Dean of the Medical School, Dean Nilsson, for their support of the Cancer Center. We are strong, and their support has made an enormous difference in our efforts. I also want to thank our associate directors, our program leaders, and our clinical leaders in the programs of the Cancer Center. I am particularly thankful to our clinical doctors this year who were in the front line of dealing, with continuing to treat cancer under challenging circumstances with COVID, but especially I want to thank our nurses. Our nurses are the front line in the fight against cancer. They are the closest partners to our patients, and they showed very strong leadership during the last year dealing with COVID. I want to also thank all our healthcare workers, and I don't want to miss anyone, from social workers to appointment schedulers, to everyone who worked so hard during the last year to deal with COVID. We are entering a new year, and hopefully things will get better. But most importantly of all, I want to thank, not just for the last year, but for the future, our patients. Our patients fight cancer with courage and dignity, and they are an inspiration for all of us. We are very committed to helping our patients, and that's why the Cancer Center exists. We are committed to bring our research from the lab to the clinic to come up with new breakthroughs that hopefully will change the trajectory of this terrible disease. So, like everyone else, I'm hopeful that next year will be better than last year, and there are good reasons to believe that. And I'm very optimistic that we will see major discoveries coming from the Lurie Cancer Center that will have an impact in the fight against cancer. So thank you again to all of you, and now you will see the remaining messages.
So hello, everybody. On behalf of all our patients and their families, I would like to extend my gratitude to all the Lurie Cancer Center teams of physicians, nurses, staff, researchers, and trainees for all that they have done and continue to do to achieve our mission to defeat cancer. I know it has been a very challenging year for all of us, but you all have proved yourself to be a wonderful A+ team, and it's my honor and pleasure to know you and work with you and continue to work with you. Wish you all and your families a very happy and healthy holidays, Merry Christmas, and a wonderful New Year. And I hope next year we can celebrate in person.
I just want to take the opportunity to thank everybody for their efforts in 2020. I think it's an understatement if we say this has been a challenging year. Obviously, we are nearing the end. I certainly hope that 2021 will continue to improve. And I just want to add my thanks to some of the folks that don't usually make it to the spotlight. In this case, our clinical trials office and our practical facility, who have remained open during the entire COVID time in order to ensure that our patients have access to the novel therapies that they need for the cancer treatment. So thank you. Happy holidays. Enjoy them safely, and I cannot wait to see you in person. Goodbye.
I wanted to take this opportunity to thank all of you from the bottom of my heart for rising to the challenges of this past year and taking our basic science programs to new levels. We've embraced Zoom. We've found new ways to engage each other within and between basic science programs. And we've implemented recommendations from the EAB by initiating new programs. I'm very excited to see how these develop in 2021. So thanks to all the program leadership, Ali and Sadie for SEND, Munshi and Carol for Team, Nav and Kurt for Mom, and Vadim and Gail for CAPS. And I'd also like to give a huge shout out to Jody Johnson, who came into the position of program coordinator under very challenging conditions. And she's thrown herself into the role of not only assisting all the programs with their activities, but organizing the Tuesday Basic Science series and integrating it with our programmatic and training programs. She's also joined Gina Kersimer in running the Carcinogenesis T32. And I'd like to thank Jody and Gina for their wonderful ideas and organizational skills to keep this training program going full speed as we approach the competing renewal deadline. And finally, to Joanne Koos, thanks for keeping me organized and setting up all those Zoom meetings all year long. So to all, stay safe and have a peaceful holiday.
I want to thank everybody for all the hard work in 2020. When I look back at this year, I can't say that I'm sad that it's come to an end, because it was obviously really tough. But that being said, I am so proud. I've probably never been prouder to work with this group than I am in 2020, because I think in a lot of ways, it was the hardest year we've ever had. More difficulties, more challenges with patients. And I really feel like our group, and I'm speaking to everybody, but my heart's in the West region. I think everyone really stepped up and did a phenomenal job. And like I always am every day, but this year especially, I am so proud to be associated with this group of people. I hope everyone has a wonderful holiday, and here's to a good 2021.
Despite a very strange and difficult year of 2020 with all of the challenges, we've had a terrific year. And I want to give special thanks to Seema Khan and Bonnie Spring in the Cancer Prevention Program, Melissa Simon and Chris Reaney in Cancer Control and Survivorship, Zishan Button, his leadership on the OMSC Shared Resource, Bonnie Spring and Bettina Yanez in their leadership on the T32 Fellowship, and all the members of the Division of Cancer Prevention, Control, and Survivorship. Happy holidays and Happy New Year.
Dear Cancer Center colleagues, we are almost at the end of 2020, and I'm sure that we are all looking forward to a more normal routine, with more opportunity for social gathering and human interaction, something that we have been taking for granted, but we learn it is not. This virtual message is to recognize individuals that, in spite of the challenge from COVID, continued their task remotely or in person and got the job done. We would have not submitted the breast cancer sport on other grants if it was not for Gina Kersimer, Robin Lykin, Alden Chang, Sabia Muket, Christine Tucker, Marsha Kojarczycki, Firas Webb, and Wenan Kiang. And we could not have expanded our precision medicine program without the effort from Janina Danway, our program coordinator, the MTB team led by Dr. Amir Bedad, and the clinical coordinator, Julie Liang. The PATCOR continued collecting specimen for banking correlative studies, and I want to mention Jeremy Matthews. And finally, the CDC labs, Qiang Zhang, Yobin Zhang, and Sabina Spaya. So all of you, I want to thank you, and the Cancer Center is grateful for your work. Again, thank you, stay safe, and happy holidays.
I wanted to say happy holidays to all Cancer Center members and staff members and leadership and faculty and affiliated faculty. It's been a very complicated year, as we know, but you guys made it actually very special. And I wanted to congratulate everybody that the year is almost over. I think we all can celebrate that. And thank you for being incredible people. I particularly wanted to thank Renee and Eleni, my comrade in arms, all core directors and co-directors and key staff. You guys were incredible. And I'll repeat that again. You were incredible, amazing. This was extremely complicated situation, as we all know, especially on the course, especially on you. You had to figure out how to operate in complicated financial conditions, with the spacing requirements, with all those things, and you managed this. And I'm extremely proud of everything that you've done. Thank you, thank you, thank you from the bottom of my heart, from the bottom of the heart of the leadership of the Cancer Center. Thank you for surviving this year and helping the Cancer Center to move on to 2021, which we all hope is going to be a great year. Happy holidays.
I want to thank my team that pulled together in this difficult year to continue our Patients First mission. Kudos go out to my colleagues, Drs. Nelson, Foster, Domrick, Coleman, Posner, Pont, and Monahan, for your hard work, dedication, and support. My appreciation to our administrative team for your leadership and guidance. And many thanks to our outstanding nurses, APPs, MAs, and nurse navigators. You guys are the best. And a special message to our fearless leader, Dr. Leonidas Platanias. Kalari Suyina, Yekronia Pola.
I am so proud of the work that you have done over this past year. We started to care for a whole new type of patient with our COVID patient populations, yet we continue to provide exceptional care for our cancer patients. I hope going into this holiday season that you can safely have time with your family and your friends. There is a light at the end of the tunnel, and 2021 will be a better year. Thank you for all you have done. Thank you for what you will do in the coming year. Have a great holiday season.